Hello and welcome back to the vlog. It is, what day is it? Sunday the 26th of April. The reason why I lost track a little bit is that I'm in the middle of 4 night shifts working in the emergency department, and why don't you come and join me on this third one tonight? So I've got my ID, my stamp to sign things off, my pen, handy reference guide, although you won't find anything about Covid-19 in there. My stethoscope, although working on the Covid side, don't tend to use this thing so much. Glasses, my wallet for lunch, and of course, my Lego. What's a doctor do with so much Lego? Well, this happened this week.
Thank you for carrying on delivering. It's very kind of you.
How many of these are there?
We got 6 of them.
What?
We get them in, we can see how.
I probably should give you a hand, not film it, right? This is insane. Oh my word. What? So what are all these, Sonia?
So there's 240 Lego sets in here, which have been kindly donated by the Lego group in Denmark, and are to be distributed amongst all of the staff, NHS employees, so that their kids at home can get a little treat. And it's my good friend Kevin and the crew at Ferry Bricks who've sent them down to us for us to distribute, so thank you, Kevin.
Thank you. Oh, that's so kind. That's going to cheer a lot of people up. Yeah, when you said we got a bunch of Lego sets coming, I didn't think you meant... How many sets are there?
240.
240?
About, I think.
This channel's fast becoming a Lego affiliate channel.
Oh wow, look, there's Lego Movie 2, Star Wars, Unikitty,
Oh, Star Wars, yep.
Ninjago, Duplo. So what we got? We got Lego Movie.
Overwatch.
Oh, Overwatch, cool. Lego Disney, Powerpuff Girls.
Woo! I'm going to be nicking that one for my secret Powerpuff collection.
Your little Powerpuff fetish, yeah?
Batman.
We got Batman.
We got Batman's in the house.
Oh man.
This is crazy. And so all this has been donated to give out to...
So Lego, I believe, we're giving out 500,000 across the world. So the UK, we're getting 30,000, and this is our little share.
Hey! This is it. This is the jackpot. Whoever gets this...
That's your jackpot.
You have hit the jackpot with this. So Sonia and I are off to distribute some Lego to the workers at the hospital. Well, for them, for their families. Here we go. Here's the delivery. Should we get it in the car?
Yes, let's do it.
This is a stray cat we've started feeding now. We call him Captain Grey. Hey Captain Grey. We borrowed a tag machine off one of the neighbours, but he's not got a tag, so in the meantime he's the homeless person we're supporting during this pandemic. So yeah, if anyone wants to adopt a cat, this little guy is the man. He's very friendly. Aren't you? Off we go!
Hey!
Car full of Lego.
Yeah.
It's like this is what it feels to be like Santa.
I know.
Doesn't it? Delivery.
Delivery.
Oh, put your eggs here.
Yeah.
Oh, she's terrible at
Lego. This is the best day ever.
So we gave out around 40 sets?
Yeah, maybe 40, 50 sets.
40,
something
50
like that.
sets. They got snapped up really quick. So I guess we'll give out the other stuff over the next...
But it was nice, it wasn't just to the nurses and the doctors.
So thank you so much to Fairy Bricks and Lego for donating that. It's made a huge difference.
Yeah.
Everyone's been really happy, haven't they?
We've really made some people smile today. It's been absolutely lovely to see. A little bit of
colour.
A little bit of sunlight. Yeah.
Also, my extensor tendon decided to disconnect from my finger, so I've got to wear this for 8 weeks. It's a bit annoying. It happened at home when I was taking off a sock. Sonia was super helpful and put an initial splint on, made up of a chopstick, so ever resourceful in this household. Got it all in the YouTube bag, keeping it on brand. I just want to say a big thank you to everyone that supported my last video where I jargon busted 26 COVID medical terms. That was all for the charity Sparks. We've raised over £3,000, which is just incredible, so thank you so much for that. So the plan for today, back in the emergency department. As always, not sure if I'll be on the red side, so seeing COVID patients, or the green side, so people that are low suspicion of COVID. Plan today, give out some of this Lego, and I'll catch up with you halfway through the shift, and I'm going to have a bit of a chat about what all of us healthcare professionals are looking forward to when all this ends, and when is it going to end. We'll have a little bit of chat about that halfway through, so I'll get in my scrubs and I'll see you then. So halfway through the shift, it is 2:30. So I'm on the red zone tonight, so seeing patients with COVID-19. You probably noticed that I don't have the terrible mask marks, that we're not using FFP3s at the moment when we see patients, so that's another change that's happened. I know the guidelines have changed a few times, so now we're just using the surgical masks. A couple of observations I'm noticing: the patients that I'm seeing with COVID, there are varying presentations and they're a lot sicker now than they were before. And I think that's really because people are staying at home. If they're having more mild symptoms, people are getting that message. So that's very much a good thing, but it does mean that every patient you see with it, you're seeing the extreme end. So you almost get this warped idea that everyone's going to have it this severe. I have to keep reminding myself that, you know, we're seeing the 19% of people that have it so severe that they need to stay in hospital. But when I first started seeing patients a few weeks ago, about half of them I found we were able to send home, and that's certainly not the case nowadays. Seems to be most of the patients coming in do require admission. They are requiring supplementary oxygen. We are seeing those bilateral chest changes on the x-ray. I was on the non-COVID side yesterday and we're seeing a change in the type of patients there, seeing a few more people coming in with drunken injuries, so I think the lockdown's getting on top of a lot of people. We're seeing more injuries with kind of people cycling and things like that, as they're using that kind of hour of exercise to get out and about. You know, this is the type of things we need to do, but please just be careful. Throughout the pandemic so far, I've always been worried about what it'd be like to be in this situation, you know, really at the peak. And things are manageable. I know it's very tough for a lot of people, and when it's not for doctors like me in the emergency department, it's really for healthcare professionals in the intensive care units and the general wards that are really struggling. Even so, we are rising up to the challenge. Speaking to Dr. Jenkins last week, it was really about, well, what do we do next? And I hadn't really thought about that, because this is going to go on for a long time. And one of the key statistics that I don't think we quite have the answer to is how many people have actually been infected in the UK in total. We're not testing the general public really, so we have no idea. So we really need some kind of data to gauge how many people have been asymptomatic. I've heard the World Health Organization said 2 to 3% of sort of the general population across the world have been infected. I'm not sure if that totally equates to the UK, because we've had quite a bad outbreak here. But assuming it is just a few percent, then that's crazy. Like, how do we then get out of that? What is our exit strategy here? We can't be in lockdown forever. The ICUs are currently at capacity, so we can't just release everything. So we're going to need some staged process. And if it's only a few percent, and we need about 60% of people, you know, for this herd immunity and for the disease to basically burn out, then that is going to take months to years and years for it to go through the whole population. What I'm really hoping is that actually the number of people infected is a lot higher, so a lot of people are asymptomatic. So maybe it's, you know, closer to sort of 20%, in which case you can kind of see how this is going to play out. That's a really important piece of data that we need. And assuming the worst case scenario, that means that things aren't going to be the same for a long, long time. And it's going to be a combination of everything to try and get it under control. So we'd have to pretty much reorganize the hospitals, continue what we're doing, continue some kind of lockdown occasionally when we hit certain milestones. We'd have to find a way to restart all those health services that have been stopped in the wake of COVID-19. Continue our social distancing. We'd have to improve public testing and then contact tracing to stop any hotspots that are spreading. So using technology would be critical to achieve that. We'd have to limit public gatherings massively and support all those industries that will be suffering because of that. So without trying to scaremonger, that really might be where we're heading for this. And what does that mean for us individually? Like, are our lives just going to be on hold? I kind of feel like that might be the case. It hit home today because we have this board at the emergency department where people have written down all the things they want to do once this pandemic's over, and they're all super sweet. And I'll take you to see them actually, and we'll show some of them on camera. What's gut-wrenching is that many of them will not happen for a long time, and I think the expectation going into this was really that it would be a few months and then things would go back to normal. But okay, we've controlled the lockdown, but we can't just release things because our ICUs are still at capacity. The government are in an impossible situation because we need some kind of restrictions. The lockdown will continue in some capacity, but I don't know if the general public are ready to hear that. That's why I think we're hearing things on a 3-weekly basis, which obviously is mandated in law that way, but the government could easily give us more information, but they're just choosing not to. There's the other side where they're evaluating all the information as it comes in on a kind of weekly basis. I hope that hasn't been too much of a depressing thought, just some things going through my head that we need to start thinking about the next steps, basically. We're luckier in the UK in a way that we've seen places like China and Italy are ahead of us, and we can kind of learn from what they're doing. But this is a difficult thing that's going to go on for a long time. We need to brace ourselves for that, and we need to embrace the changes that are rolled out, because we can't bury our heads in the sand with this. We've got to get through it. So I think we need to expect some big changes in our daily lives for a while. So I've got a few hours left on this shift. I'm going to take you to see that that beautiful board that the staff have been filling out in A&E that shows all the things we're looking forward to. As much as it's been not the brightest thing to talk about, we do need a bit of motivation to rise up to the challenge. When all this is over, go to Mass and the gym. Go to France to meet my niece and nephew and see the family. I will go to John Lewis, buy everything and have a cup of coffee. Hashtag not sponsored. My engagement party, that's a sweet one. Go for a nice meal, yes! Seeing and hugging my boyfriend and family. My wedding to go ahead with my family. Have hugs. Never underappreciate the hug. Again, to squeeze my mum and dad. Hot date night with a fit man. I will go on my honeymoon, see my baby families and have the ED team back to its normal jovial rhythm. Going to the pub, classic English one. There you go, a little selection of what people are looking forward to. So, another shift done on the COVID side, and much like before, we have lots of capacity at the moment, but the people that we are seeing come in are pretty sick. I've seen a fair few healthcare professionals as well, and I know a few of my colleagues are off purely because we've been a doctor down for the last couple of days, but because it's been quite quiet, that's not really been an issue. I know a fair few of my colleagues who have had symptoms that, you know, sound very typical COVID-19 are actually coming back with negative swabs. I know a lot of tests can be falsely negative, but seems like more than I would expect. Also, the old baby Jesus finger doesn't make the hand hygiene very easy to do, but I'm kind of trying my best. Have to wear a lot more gloves and had to clean it a fair few times, but all in all, not a bad shift. So 3 down, 1 more to go. Feeling good, gonna have a nice little sleep today. Hopefully enjoy some of the sunshine, get some vitamin D. May or may not be useful in combating coronavirus. Hope you're all well. Thanks again for all the support, and I'll be back soon.